Welcome. I am Terry Tropin, and today I'm presenting a lesson on ICD-10-CM coding for chronic obstructive pulmonary disease, commonly referred to as COPD. First, let me start with information about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have an RHIA and CCSP certifications. Also, I am an AHIMA-approved ICD-10 trainer. I have taught health information technology at Montgomery College in Maryland for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, one on ICD-10-CM coding, ICD-10-PCS, and external cause coding. These are available on Amazon. COPD is a condition in which the airways become obstructed, almost always because of cigarette smoking. The problem with coding COPD is that it overlaps with emphysema, bronchitis, and asthma. This presentation discusses when to code these related conditions with COPD and when to code them separately. And here is a list of all the many conditions that are included in COPD. So in finding out figuring out how to code COPD, you need to ask yourself these questions. I will talk about each one of these questions in turn. The ICD guidelines instruct us on how to code for these conditions. Use codes from category J44 and J45 for uncomplicated, complicated, and acute exacerbation of COPD. The guidelines also define acute exacerbation, which is a worsening or decompensation of a chronic condition. Note that this is not the same as an infection superimposed on a chronic condition, although an exacerbation may be triggered by an infection. A patient may have a chronic condition and then have an infection, but this is not automatically considered an acute exacerbation. Here are the subcategories included in J44, COPD. You have with acute lower respiratory infection, J44.0, with acute exacerbation, J44.1, and uncomplicated or COPD not otherwise specified, J44.9. There's also notes under each one of these, and we'll talk about them more as we go along. So COPD category J44. This includes asthma with COPD, chronic asthmatic obstructive bronchitis, chronic obstructive asthma. It also includes chronic bronchitis with airway obstruction, with emphysema, with chronic emphysematous bronchitis, chronic obstructive bronchitis, and chronic obstructive tracheobronchitis. Now there's a note under the asthma code, under the CPT and the COPD and under the asthma code. Code also type of asthma if applicable. So that's referring you to the J45. COPD unspecified is J44.9. So in COPD J44, there's some exclusion notes. These are not coded as COPD: bronchiectasis, chronic bronchitis, NOS, chronic simple and mucopurulent bronchitis, chronic tracheitis, chronic tracheobronchitis, emphysema without chronic bronchitis with aspiration pneumonia if COPD is not documented. This also excludes 2 note, which means you can sometimes, if appropriate, report J44 and another code. COPD with acute bronchitis, you have J44.0, which is for acute infection, and J44.1 for an acute exacerbation. You might also need to do a code for the infectious agent if that is documented, the strep or whatever. Also excludes two is lung diseases due to external agents, code both J44.1 and a code for the condition caused by the external agent here. Chronic bronchitis may be included in COPD. The airways become inflamed due to viruses or environmental factors such as tobacco or pollution. It's included in COPD if it's chronic and obstructive and or with emphysema. So chronic bronchitis included in COPD and chronic bronchitis not included in COPD. Note that the included list states obstruction while the not included list does not. Both lists use chronic, but only the included list has obstructive. So the documentation here is so important. And if it's not clear, you need to ask the physician or the provider in order to figure out whether it's COPD or not. So chronic bronchitis with obstruction or with emphysema is included. Chronic bronchitis not listed as obstructive or with emphysema is not. So you need that obstruction. So here's a summary of COPD and bronchitis. Note that a separate code is not used to indicate the bronchitis. Use only a code for the COPD, J44, to indicate both the bronchitis and the COPD. Though you may need another code to indicate the infectious agent. The last four rows in this table list conditions explicitly, specifically excluded from COPD. Without any additional documentation, you don't code these conditions with COPD. So let's do a practice. If you wish, you can turn off the recording and code this case yourself, then turn the recording back on to check your work. So COPD with chronic bronchitis with acute exacerbation. What diagnosis code would you use? So we're going to use J44.1, which is COPD with acute exacerbation, and then J44.0, COPD with acute bronchitis. So you have another code that the chronic bronchitis is included in the COPD code, but you also do the J44.0 for the acute. Asthma. Asthma is another condition closely related to COPD. In asthma, the bronchial tubes spasm and constrict acutely in response to a specific trigger, such as allergen, exercise, or emotional stress. So when the patient is exposed to these triggers, it may bring on an asthma attack. Asthma is included in COPD if it's chronic and obstructive. So again, just like with bronchitis, it depends. So what is asthma? Asthma may be described as extrinsic or intrinsic. It may be allergic or non-allergic. So intrinsic means it may be triggered by weather, exercise, infections, or stress. This is also called non-allergic asthma. Extrinsic is done by pollen, mold, dust, pet dander, things like that. It's also called allergic asthma. For example, hay fever is a kind of extrinsic asthma. So in the codes for asthma, you have codes for mild, moderate, severe, mild and moderate, severe, intermittent, and persistent. So there are additional digits in these codes to indicate whether it's an acute exacerbation or a status asthmaticus. Asthma is included in COPD when it is documented as with COPD, chronic, and obstructive. If the patient has COPD and asthma, you code the COPD from J44 and a code for the asthma from J43. Contrast this with bronchitis, which uses only one code for both the COPD and the bronchitis. So, under category J43, asthma, there is an excludes to note for these conditions listed here: detergent asthma, eosinophilic asthma, etc. Could they be present with COPD? Well, maybe. In that case, you would use the appropriate code and a COPD code. So here's a summary of COPD and asthma coding. Note that there's a separate code to indicate the type of asthma. Another code may be used to indicate infection. Asthma without COPD is not coded to J44. Now, if you look at the last two rows of this table here, it's conditions specifically excluded from the asthma category J43. So if it's asthma due to external agents or eosinophilic asthma, you're not going to code from J43. You're going to code the appropriate code, and those are listed here. Now, is it possible that these can exist with COPD? Sure. In that case, you do the J44 code for the COPD and the appropriate code for the asthma. See, it says may or may not be related. May or may not be related. So here's another practice. If you wish, again, you can turn off the recording and code this case yourself, then turn the recording back on to check your work. Patient seen for moderate persistent asthma with acute exacerbation. Documentation indicates she has COPD, but no acute exacerbation or infection at this time. So the coding is J45.41 and J44.9. So the patient is being seen for the asthma, so that is coded first. J44.9 is used because there's no exacerbation or infection documented. So we're going to use the unspecified COPD code. A patient may have COPD, chronic obstructive bronchitis, and chronic obstructive asthma. In this case, list a code for the COPD, J44, and a code for the asthma. Remember that bronchitis is already included in the J44, but the asthma requires a second code. Another condition associated with COPD is emphysema. This is when the air sacs in the lungs are enlarged, therefore losing their elasticity, making breathing increasingly difficult. And here are the possible codes. There's J43.0 unilateral, J43.1 panlobular, J43.2 central lobular, and then of course other. If it's obstructive emphysema, then it's included in COPD. Emphysema is included in COPD if it's documented as chronic. If not, it is not included in COPD. You're not going to list a separate code for the emphysema, even if it is obstructive in COPD. You have emphysema with COPD, emphysematis, obstructive bronchitis, so this bronchitis and emphysema, J44, emphysema with chronic obstructive bronchitis, also J44, and then emphysematis bronchitis also. So it's all referring you to J44. So you're not going to list a separate code for the emphysema. Emphysema is coded from J43 in most cases when it is coded. But here's a list of other kinds of emphysema. So excludes one, not included in J43. Emphysema due to an inhalation of chemicals, gases, fumes, or vapors. Interstitial emphysema, mediastinal emphysema, neonatal interstitial, and surgical emphysema. Those are all not included in J43. On the other hand, there's also an excludes to note. So you would report this with J43. Traumatic subcutaneous emphysema. So air enters the chest following a trauma. Emphysema is included in the J44 CPT code if it's documented as emphysema with COPD, or if the documentation uses the term emphysematous. So here's a summary of COPD and emphysema. Note that no separate code is used to indicate the type of emphysema. Another code may be used to do the infection. Emphysema without chronic bronchitis is specifically excluded from COPD 43. So notice these codes are excluded from emphysema. This code is excluded from COPD. Now, if the patient has a condition excluded from emphysema and also has COPD, if that happens, you can do J44 and one of these other codes listed here. Here's another practice. Again, if you wish to stop the recording to code this yourself, do so. The case is patient seen for acute bronchitis due to streptococcus infection. Documentation also indicates he has emphysema. The emphysema is not documented as obstructive or chronic. So what you're going to report is J20.2 for acute bronchitis due to strep and emphysema, J43.9. This is not coded as COPD since the bronchitis is not obstructive or chronic. There's also possibility that the documentation says it's tracheobronchitis. So tracheobronchitis may or may not be included in COPD. It is included if documented as chronic and obstructive. Code only the COPD, but no additional code for the tracheobronchitis, except for maybe a code for the infection. So if it's not chronic and obstructive, it's not COPD, unless it states specifically that it's COPD. So the documentation, as I said, is really important. So other codes. Through all of these, you may need some other codes. Use additional code notes under categories J43, J44, and J45. Same note. It says use additional code to identify exposure to environmental tobacco smoke, history of tobacco dependence, occupational exposure to environmental tobacco smoke, like a bartender, tobacco dependence, and tobacco use. You see kind of a pattern here. All of these are tobacco. How do you get COPD? Usually tobacco. Now for J45 only, there is another note. Use additional code note for eosinophilic asthma, J82.83. And this involves the white blood cells that are part of the immune system. So you would do asthma and then eosinophilic asthma. Okay, there is no way to remember all of these guidelines. I think that's particularly true when it comes to something complicated like COPD. So here's some suggestions of what you might write in your book. In the alphabetic index, find the entry for Cooper's disease and Copra itch. You'll see that there's nothing in there for COPD, so write it in. Write COPD J44. And then you could go into disease, pulmonary, chronic, but this is a lot easier if it's just under COPD. Now you might also want to find disease, pulmonary, chronic, obstructive, and note the page. And then go back to where you wrote in COPD and say, see page such and such. and that will save you a lot of time, okay? In the tabular list, circle the use additional code notes under J43, J44, and J45. Also circle the includes notes under J44. These are codes that are not coded separately. Also circle the includes notes under J45. These are not coded separately. So it's really important to differentiate. Do I code this separately? Is this included? Circle also the code also type of asthma note under J44. And then circle the code also infection note under J44.9. So the information is in your book. It's just confusing, and if you do it this way, it will save you some time. That completes this lesson. If you have questions or comments, please feel free to contact me. I would love to hear from you. If you would like a copy of these slides, just ask. Here's my contact information on Facebook and email. And here are the books I've written on coding. I have a PCS book, a CM book, an external cause book, an evaluation and management book. These are updated every year. The easiest way to find them perhaps is to go to Amazon Books and type in Tropin, T-R-O-P-I-N. Thank you so much for listening. I hope to have more lessons up soon. Thank you.